Good evening, Town of Littleton. This is the Board of Health meeting for February 25th, 2026 at 7 p.m. This evening we have Mr. Matt Wason, Mr. Dan Kane, and Mr. Kevin Baker, and your chair, Kevin Davis, here at the meeting. It is 7 o'clock. Our first thing up is the continued public hearing for 9 Woodland Drive. Francis is actually in the audience. Could somebody please promote Francis? And we will now, as soon as Francis comes in, there's Francis. And we have Francis in our meeting. Yay, Francis. Okay, so it's our 7 o'clock continued public hearing for 9 Woodland Drive. Francis, according to your public hearing notes, the contractor asked the homeowner to contact town staff to schedule a joint site visit by assessor and Board of Health to confirm both total room count and bedrooms. No response received from either assessor or Board of Health. Second request made and still unanswered. Is that still the case?
Yes.
Okay. Then I recommend that the board continue this meeting till our next available meeting, unless somebody else has an objection about it.
So moved.
I have a motion.
Do we have just no answer, so we have no idea why we didn't get a response and why they weren't able to make this meeting?
Correct.
So do we automatically continue to the next meeting, or
I'm recommending that we continue it to the next meeting to give them a chance.
okay? We missed our last meeting, right? So it's been a month. To have no response to a month to something that they actually want just strikes me as odd. I have no idea who the people are involved. It's not a personal thing or anything. I'm just wondering if to effectively, do we vote to say no and tell them they have to start all over, or do we continue it without a date assigned and say that?
I said, let's continue it to our next monthly, at the end of the month meeting. That's what I said. And then, so I had Kevin Baker move on that.
Correct.
Right.
There's no second, so I'm asking questions.
No. Yes. And you're within your right. I'm not saying, but that's what my recommendation was.
Okay.
So the reach out was to the homeowner. Did we also go through the contractor, since they may have a better chance of getting through to the homeowner than we might?
I did both.
Okay. No, I'm sure you did. I'm just closing the loop, making sure we tried. We have done our due diligence, that if we've talked to the contractor who we've talked to and reached out to the homeowner and there's been no response.
Okay, I'll second.
Motion seconded. Okay, I will take a vote. Dan Kane.
Dan Kane votes yes to continue.
Thank you. Matt Wason votes.
Matt Wason, yes.
Kevin Baker.
Kevin Baker votes yes.
And Kevin Davis, the chair, votes yes. So we have continued that meeting for that one. 7:10. Okay. So since it's not 7:10 quite yet, so we don't want to start our next public hearing, let's go to some administrative matters meeting minutes. Let's see if first question, has everybody reviewed the meeting minutes that are in the packet? All that kind of good stuff. Yes. Shaking of heads. Yes. Kevin, you need to verbally say yes or no.
Yes.
Okay. All right. So then let's go ahead and look at the packet. And let's go to the first one. Oh my goodness. All right. So the first one in the packet is the January 28th, where we had Kevin Davis, Dan Kane, and Kevin Baker present. 3 of us are here. Board of Health members absent was Matt Wason. So are there any changes that we need to the January 28th meeting minutes? Okay, hearing none. Could we have a motion to accept the meeting?
I'd like to make a motion to accept the meeting minutes as presented.
Do I have a second?
I'll second for the January 20th, 2026 meeting minutes.
Okay, we're going to take a roll call vote. Dan Kane,
Dan Kane votes yes.
Matt Wason,
Matt Wason abstain.
Kevin Baker,
Kevin Baker votes yes.
and Kevin Davis votes yes. So those meeting minutes have been accepted. Let's go to the next one, since we're still at 7:05. We got the October 22nd, 2025 meeting minutes as presented in the packet. Does anybody have any discussion points or corrections they would like to make? Hearing none, I need a motion.
I'll make a motion that we accept the minutes of October 22, 2025 as presented.
I'll second.
Motion and a second. Let's take a roll call vote. Dan Kane,
Dan Kane votes yes.
Matt Wason,
Matt Wason, yes.
Kevin Baker,
Kevin Baker votes yes.
and Kevin Davis abstains. Okay, so the 22nd minutes are accepted. And our final meeting minutes are November 12th, 2025. At the present of that meeting were Kevin Davis, Matt Wason, and Dan Kane. Kevin Baker was absent. Do we have any comments on the meeting or additions? Hearing none, I need a motion.
I'll make a motion that we accept the minutes of November 12th, 2025 as presented.
I have a motion.
I'll second.
Seconded? Yep, heard you. I got it. I have a motion and a second. Let's take a roll call vote. Matt Wason,
Matt Wason, yes.
Kevin Baker,
Kevin Baker abstains.
Dan Kane,
Dan Kane votes yes.
and Kevin Davis votes yes. Okay, so all of our minutes have been completed. Yay! All right. We are still 2-3 minutes out from our next public hearing. We can go into correspondence. Any light correspondence that anybody has had that they would like to discuss? Very light, knowing that we have something to talk about in 2 minutes.
We just got notified today that we received a grant for $96,000 for substance abuse related counseling and peer coaching. And then we also received a grant in the partnership with Emerson Hospital for blood pressure awareness. So that'll be coming soon as well.
Nice. Congratulations.
Yeah, seriously, nice job.
Great work.
Do we have plans for the substance abuse counseling outreach? Yeah,
Not
obviously
yet.
there's something for the grant to get approved. So
Yeah, I mean, it's pretty broad. We're going to narrow it down and then figure out the budget of itself, where the cost will go, where you submit that to them and then they approve on that as well.
Oh, awesome.
awesome.
That is great news, and I'm really glad to hear it. Nice job. Is there a specific timeline for the statement of work that you have to put together or anything like that?
I haven't even gotten the official notice yet, so once I get that, I'll have a better idea.
Okay, cool. And then is it just 1 year? Is it 2 years, 5 years?
It looks like it's a multi-year grant. You have the option to renew, but they say it's not guaranteed. So,
Okay. All right, that is way cool. Awesome. And then the other grant you said was for blood pressure monitoring from Emerson?
yeah, it'll be an educational awareness campaign.
Oh, okay. Cool. Perfect. Oh,
Yeah.
congratulations on that. Okay. Well, it is now 7:10. We're going to do our public hearing for 21 Lakeshore Drive building permit variance request setbacks. So why don't we bring in the engineer? And if anybody in the room wants to raise their hand, unless Francis already knows who or whom the person is, we have Josh or Joan, Josh, and Tim.
Miss Hamlet is here on behalf of the Leominster Tobacco Control Alliance.
Okay.
I'm not sure who Tim is. I've been talking to an architect called Chris Rogers regarding this property.
Okay.
If you're in the audience and you're a part of this public hearing, please raise your hand so that we can promote you.
What Matt said. Okay.
Okay.
Oh, we have some notes on this. So the contractor submitted a building permit for an accessory building. The proposed building would contain a garage space, a work area, and a partial basement. It would have heat, but no plumbing or water service. Title V requires a 10-foot setback for slabs and a 20-foot setback for foundations. The partial basement foundation would be within the 20 feet. Variance requested is 15.211 minimum setback distances. Survey titled Sketch of Septic Offset dated to May 11th, 2023 notes that the leaching field location is based on stakes set by the property owner with approximately 12 feet. Confirmation of leaching field location by licensed septic installer or professional engineer was requested by staff. Applicants have preemptorily applied for deed restrictions already. Okay. Well, do you want to walk us through what we've got in this lovely packet then?
I don't know if we can without a representative of here. I'm not really sure.
Okay.
Unless it drove some questions that we wanted to research before the next time, I wouldn't want it. Any discussion we have is going to be immediately filled with assumptions, I think.
Sure. My whole thing is that we have worked really hard to maintain the setbacks from anything. And also, if we haven't been able to have the setbacks for foundations and things like that, we've asked to have a liner put in and all kinds of fun stuff. So I know that's kind of my thoughts on those things. Dan's kind of looking at it.
Yeah, so I'm looking at the drawings still.
Yeah, me too. There's lots of drawings.
Francis, are you saying under the staff notes, are you saying that the leaching field is 12 feet away from the proposed foundation?
Yeah, approximately.
Okay.
But it hasn't been located by a licensed septic or surveyor or anything like that.
Right. But that we also would typically say a 20-foot setback for that as well.
Mm-hmm.
Right?
Yeah.
Okay.
Yeah, and like I said, we've worked really hard to maintain those setbacks and things like that. And if there's no other option, encroaching in on those meant including rubber bladders and things like that.
We did ask if they'd be willing to remove the partial basement, which would change the application, but they said they really want to go forward with the basement because they need the storage.
Okay. And it's going to have no water.
Correct. Yeah.
There's not a bathroom over there at all.
No. Just 3 basic spaces.
And this is falling under the ADU. How?
It's not falling under the ADU. It just, if it looks like it, then it's questionable. Water service isn't that hard to finish over the line, so it wouldn't take much.
I see. And then it's also within the 20-foot boundary. That's the reason why. Okay. All right. I got it.
Yeah.
That's the reason why. All right. I don't understand.
I mean,
all right.
they're not here, so I would say we have to know the plans of the main house, because this would be effectively adding a room to the property, correct?
Yes.
Okay, so we'd have to do our typical room count based upon what the existing structure has. Yes, this is not a bedroom they're building, but it is a room.
Mm-hmm. I think we did. I'm just not 100% sure at this point. It was a while ago. But I think that's why we talked about deed restriction.
Yeah, with no heat and no water, it's a different situation.
It has heat.
It has heat but no water.
I see.
I mean, it's the same as a finished basement space, right?
Yeah, you're just doing it with another build with a different.
Just it's detached, but it's the same as a room then.
Yeah, it's the same conversation as a basement space. That's very good. Okay.
I mean, at what point does it go from being a shed to being a room? I'm not trying to place. But it's like okay, it's got electricity, it's got heat, but I can put a heater in my, Reed's Ferry shed in my backyard. Obviously, this is much more finished. It's got fans, it's got walls, it's named studio.
So for like a porch, as soon as you have heat and insulation, it's a part of the house, right? Your 3-season porch is not a room if it's not insulated and doesn't have heat. But heat plus insulation turns it into a room. So I assume it's insulated if they're putting heat into it.
But it's attached. A porch is attached to the house where this is an outbuilding. I don't know. I'm asking the question because I see it as a room as well.
Yeah.
But again, it's like, where is that line between a heated shed and a room?
And an ADU is detached, can be detached, right? And falls under the same guidelines.
Mm-hmm. Yes. But an ADU is a living space that has a definition of blah, right? This doesn't fall into that definition.
No, but I'm just saying attachment is not, I don't think attachment is a criteria that we typically look at. Whether it's attached or not, it's a room on the property. That's how I would interpret it. It would be great to get some clarification before this is brought to the board again, just so that we don't have to punt it down the road a second time.
And that would be good. And I also think the reason why it's coming to us again is because there's a basement and it's within the 20 foot of the leaching field or the tank. Sure. So now you're disturbing the soil.
Yeah. Well, I understand that's why it's on here for that variance request. I'm just saying, let's not have it show up next time we look at the room count and then it's something wonky and we have to kick it again. Because we shouldn't approve the variant request just for that piece if we're also having concern. I know it mentions the deed restrictions, so maybe that's already taken care of, but I apologize, I don't remember this property. So I just think when they come to the next meeting, let's make sure we've got all the ducks in a row so we can actually discuss it if they're here and approve it or deny it per that.
Yeah. Okay. So go ahead, sir. No, go ahead.
Just so I can, obviously we are not kind of acting on this tonight, but just to make sure that whole piece that we have our answers for when they do come before us, that if this were granted, I know in the past we've done, okay, you need impervious barriers on the outside of the foundation and those kind of things. I didn't see, I'm looking back at Francis's notes, if there was any conversation of, if this was to go through, what would be the mitigation? And I don't think I saw anything in their plan. They get great construction plans, but I didn't really see anything about what their mitigation, or was there a mitigation plan in response to the variance request. We realize we're doing something outside of the norm, and to make this as compliant as possible, we are doing the following. I mean, they may have that verbally, but I don't see it here. But again, it's 15 pages of construction plans. I'm just not seeing that focused out.
I think when we talked to them, they were going to do a poly barrier maybe, but I'll just make notes to get answers for these for the next meeting.
Yeah. And if you guys look at it, it looks like also that it is connected by a elevated walkway. a boardwalk. So that's the other thing, is that we got to make sure those pylons that they're using to support the boardwalk aren't also within that buffers, or yeah.
We're having the whole conversation without them. They
I know.
don't actually know where the fields are. Was there an as-built for this?
There's not. The engineer did do that plan by places, but I was a little concerned that they used the homeowner stake marks as part of it.
Yeah, I was gonna say, if we don't have an as-built and we're just going by, it's about here, is probably not adequate for that kind of an offset, and then also putting in, looks like pillars for a boardwalk, and in some places over the leaching field is what I thought I saw. Again, there's so many pages, it's hard to.
It's really close to the leaching field. I don't see it. If the gray area or that tan area is the leaching field, which I'm guessing that's what it is, it gets really close, but it's not there.
No, it's not actually. You're right. Sorry.
No, it's all good. But it's within the zone. So it's not even the foundation. You also have that within the zone as well. So it's not that the foundation is 12 feet away. It's that there's a pillar that's even closer.
All right. So we have lots of good questions for the petition.
Whomever.
Make a motion to continue.
Motion on the table. Any discussion or a second?
I second that.
We have a motion and a second for a continuance to the, I would assume it's to the next meeting, Matt?
Sure.
Okay. I'll take a roll call vote. Matt Wason.
Matt Wason, yes.
Kevin Baker.
Kevin Baker, yes.
Dan Kane.
Dan Kane votes yes.
And Kevin Davis, the chair, votes yes. So we are moving that to our next end of the month meeting. Yay. All right. 7:15. We're over the limit for that awesome discussion on the tobacco regulation update. So let's go do that.
Promote Miss Hamlet.
Matt, are you taking care of that? And you are. Excellent. And there was a couple of PDFs that were sent around, and there were some notes that were sent around.
Be in. Can you hear me?
We can hear you.
All right,
Welcome
great.
to our meeting.
Hello. How is everything in Littleton, Mass? Are you guys? Oops, I'm sorry, boys. They heard your voices, so my dogs are barking. I'm sorry.
It's okay.
So, are you guys all dug out in Littleton, Mass?
Littleton, I think we got somewhere between 10 and 14 inches of snow, I think is what people are generally saying. So somewhere around that.
Yeah, that's
and
where we
and
were
then we-
in Athol.
And then we got about an inch and a half today, at least at my house. I don't know where everybody else got, but about an inch and a half.
Yeah, we got about 3 today.
Whoa.
I'm in
Oh.
Athol.
Got it. I really feel for the people on the outer Cape and southeastern Massachusetts right now. Oh my goodness.
Well, they usually get a lot less than everybody else, so they really got hammered.
Yeah, and the power only goes in one direction from the Cape Cod Canal forward. So when you lost power back, you lost everything.
Yeah.
That also sucks.
Yeah.
So I really feel for our residents that are out, not Littleton residents, but Massachusetts residents that are out there.
Yeah, it's been a brutal winter. We had our Athol Board of Health meeting earlier today, and we had a warming shelter like consistently open for the last several months. Where I think last year we only opened it maybe 3 days total. So it's been consistently open for the past month. But getting back to tobacco, I am on the
Yep.
agenda.
You are.
We gave a draft regulation that Francis got to the boards, and he had asked me a couple of questions by email. So I didn't know, Francis, if you got my email today. I responded so you could forward it to the board members.
I did earlier today. Yep.
Okay. So what I did is I answered the questions as they were asked in the email, and then I gave a checklist. This is the cover sheet of the draft reg. So I highlighted everything in blue that you already have, and then I just kind of where you could make decisions, I made a few recommendations. So I'm not sure where
Okay.
you want to start with this.
Well, why don't we go ahead and, it's to the purview of the board. That's members that are here tonight. I'll open it up to them to see if there's a constant direction. As far as the chair goes, I see an interactive discussion amongst people, and we can walk through things and make sure that we answer our questions that we answered. And if we have any other further questions on the highlights and things like that, we could quickly ask that. So why don't we go ahead and go through our questions and things like that?
Okay. So the first question that was asked to me by Francis by email was page 10, retail density, the maximum number of permits. You guys have a straight cap. We don't feel that you have the density issues or some of the issues regarding why you would need to limit retailers to do the restrictive retiring cap. So we recommend that you stay at a straight cap. However, you guys have had 10 retailers for so long. Since you passed this reg, there's been no increase in your retailers, and it's a good thing because somehow in the signed document, the number is missing. So you have a cap, but the number isn't there. So it's just blank. So you have 10, you've consistently, so no harm, no foul. I have no idea how that happened. I can't speak to how that happened. Either
We're gonna
bad
fix that.
proofing or somebody doing the final draft and missed it in the proof. So what we usually do is we recommend boards to, if you're doing a straight cap, the goal isn't to stop business from coming in. It is a retail density strategy. It's to manage the business that's there. So we usually recommend that you do, if you have 10, you do 1 or 2 more. Most boards do 2 more. And that allows, if something comes in unforeseen, like maybe we had a community that developed this digital way and it turned out to be a big shopping plaza, and there was a Market Basket and a convenience store and a paper store. They all wanted to sell tobacco, and there was only 1 permit. And it was, 2 had to go on a waiting list. So it's just unforeseen things. So we would recommend that you cap at 11 or 12. And then what happens then is if somebody comes and wants to, they go on a waiting list and wait for one to become available. So you could cap at 12. We don't have major problems in Littleton, and we have pretty good compliance, and we work really well with the retailers in Littleton.
Okay.
So I think you could cap at 12.
Okay. So, board, let's have a little quick discussion about that. Does anybody have any points or anything they'd like to talk about as far as the cap goes?
So we can't talk about putting a cap on that has to be reserved for an advertised hearing. This would be
No,
more
understood.
language.
No, it's
Yeah.
it's just discussion. I'm not saying we're voting or doing anything like that. All I'm just saying is there any discussion surrounding that?
Yeah, we have to tell you what to type into the document, right?
Right. Yes. So what the board can do is what we're doing is we're reviewing the checklist, because the process is we go over this checklist and you go over and decide what do you want in the draft. A lot of boards leave everything in the draft and let the public hearing decide. But if you're not interested in being more restrictive, there's nobody going to come up to a hearing and say, please do a retiring cap. People aren't going to come to the hearing. So we usually, when I go over the draft reg, you tell me what you'd like in it to present, because the next step would be presenting it to the public in a public hearing. And in the public hearing is where the board is discussing. So you're not voting on
Yep.
anything. You're just discussing what do you want in the draft to present to the public.
Yep. Agreed.
Personally, I think 12 sounds fine, so I wouldn't have any offense to that going into the draft.
Yeah. And you can make that final decision when you vote on the reg, but this is an actual error in your current reg that could be corrected with or without a hearing, but we might as well correct it and upgrade the whole thing at once.
Yep. Okay.
Okay. And then the next question in the draft that Francis presented was oral nicotine pouches, whether to cut off at 6 milligram on page 11. It is recommended in the state draft. This comes from MHAB, Mass Municipal Association, and ACASTA legal teams. And the recommendation is for local boards to cut it off at 6 milligrams. We've seen pouches as high as 34 milligrams, and people can pop them like Tic Tacs and candy and have 2 or 3 pouches in their mouth at a time. Nicotine poisoning control calls have gone up 400% since pouches have hit the market. So we're very concerned. What's happening here in school and workplaces, people are using these pouches now for the nicotine, and then they're going home and doing, whether they vape, smoke, cigars, whatever their tobacco of the choice is. So there's actually a significant increase in nicotine pouches because where workplace takes away their ability to smoke in public and workplaces, the nicotine fix is being replaced by these pouches. So, it really is we're finding more and more schools and parents are reporting youth using them, even if they're not flavored, just to kind of keep that nicotine going. So we do recommend 6. We have multiple communities that have had no problem implementing the 6 milligram with compliance.
So, quick question that I have, because I don't know this. What is the milligram size of the nicotine patches that you can buy at a CVS or a Walgreens or whatever?
There is Walgreens and CVS's don't sell nicotine pouches because this is not
the patches, the dermal patches.
The patches. Oh, that I don't know. I don't know that because what that is with the nicotine patch, it's a medical approved device and there's a program that you start at a certain level and it's prescribed to you based on how much you smoke. So if you're a 3-pack a smoke day, you're going to get this pack, 2-pack, 1-pack. So it's very tailored and it's a tapering. They taper off. So if you want me to get that information for you, I can.
I was just doing it as a comparison in my brain. That's all that I was doing. Anybody else have anything about that? Or am I? Go ahead, Matt.
Oh, not about that specifically. I have another question.
Oh, okay. Before we go to that question, I just want to point out with nicotine patches, they come with medical instructions, poison control numbers. They come with all kinds of, if you have this symptom, stop immediately and call your doctor. So it's a very controlled product.
No, I understand. I'm accepting that what it is. I was just more interested in seeing what that level is that we're there that has all those controls. That's all I was asking.
Yep.
And then I guess. What's the standard amount of nicotine that is in a cigarette that people or a vape that people are ingesting?
I think it varies between 3 and 5, but I don't know. There's 80,000 products out there, but I think it varies between 3 and 5.
Okay. Thank you. Does anybody else have any questions on that one? Yes, Matt.
So, I'm not sure if our question was about whether we should do the 6 milligrams or not. In looking at the document, the way the language looks at, it looks like you either choose between the statement that says don't sell more than 6 milligram per pouch or only allow them to be sold in adult only retail tobacco stores. And that doesn't feel like an either or choice for me. Am I reading it wrong? Or is there a reason not to have both of them combined into one?
You could combine them into one, but an adult retail store, you would do 6 or 6 in an adult retail store only. We're not recommending that you limit them to only the adult retail stores. We're recommending allowing everybody to sell them and not allowing any more than 6 milligram. But it would be 6 milligram for everybody or 6 milligram in an adult only store. So the wording might be a little unclear. Okay, yeah, because the 6 milligram per is not included in that second phrasing. So it sounds like if you went that route, you would not put a limit. We could, what you're saying, but your recommendation is to not limit it to adult only and just have this 6 milligram. Correct. Okay. That makes sense to me. Okay. The next question was, there was some confusion about what the cigar sales purpose was, why single, why bulk. Wasn't sure if I could shed some light on that. And basically, cigar pricing and blunt wrap restrictions are in direct relation to youth. And a lot of these products were in towns that don't restrict the single cigar to $2.50 or more plus tax or more, or 2-pack or more being $5 or plus. You can get like the 2-packs, 3 or 4 for 99 cents. So it's to stop kids from pooling lunch money, using their lunch money or whatnot. And pricing has been a big indicator in helping reduce youth use. So we do strongly recommend that you stay with the pricing. We worked with retailers for a long time to get them used to single cigar is $2.50 plus tax. Any pack of 2 or more is minimum $5 plus tax. In the model draft, they do raise it to because it's based on tax index, and they raised it to 280 and 530 or something like that. We worked so hard with retailers that over that 20 cents or 30 cents, we didn't want to confuse retailers unless we were going up significantly higher. So we recommend that you leave it at 250 and 5. And it eliminates the lunch money purchases and whatnot. And then the most local, all of our retailers, 44 of our alliance towns have both these in their regulations. Majority have it. Majority of MTCP funded boards that have a tobacco control person, such as myself, have cigar pricing. And I think we put them in Littleton's regs back in 2014. So this has been a consistent policy that you've had in your regs for a long time, and the retailers are very consistent and used to it. So we recommend keeping it as is.
Okay. Any comment or discussion from the board?
And then the next one, I wasn't really sure. It says which language to use for the flavored tobacco products prohibited on and content on page 11 and 12. Everything in yellow is state language, so you have to use the state language. And then there was a couple of sections where they added 3 words in a couple of the paragraphs, and that was like local. And it was just to further clarify the intention of that state law. So we recommend just leaving that whole section. Everything in yellow has to be in your reg because it's already in the state law and we're already enforcing it in a separate document for you. But those few green words are words that the CAS legal team felt by incorporating them in, it makes it clearer what the intention is of those flavored products. So I wasn't sure what the question was because when I looked at that, it's all yellow, which means there was just a couple of sections on that page. And the words, I can look it up for you right now.
No, so basically what you're saying is that there's a specific language from a CMR that says this has to be here. Your organization has said, hey, if we add these 3 key words into that list, it strengthens it, which is a local thing that we're allowed to do to make it better. So, okay.
Possess, hold, and keep. So that those words get repeated in green in 3 different parts of that. So because it's possess, hold, and keep. So that's the what they want you to add locally, and it's standard.
Okay.
Yep.
All right.
And then the last one was penalties, option 1 or 2. We highly recommend keeping them separate and for your local components of your reg, which would be like cigar pricing, the blunt wrap ban, a few other minor things. We would, the nicotine pouch being more than 6 milligram, we would highly recommend you keep that to your local fines, which non-criminal fines used to be 100, 200, 300. That's what you have in your current reg, but it's very standard now that everybody goes to a straight 300 on the local components for first offense, second offense, and third offense. And that's entirely up to you if you want to just do 300 for all, or you still want to toll them 100, 200, 300. But then if there's a sale to a minor, or there's a flavored product, or they have nicotine content higher than 5, you have to use the state fines of 1,000 to 5,000, and they're very separated in your reg, and it's clear in your reg. And as your agents, we're experts at tolling those and keeping them separate. The goal isn't to be punitive. The goal is to educate the retailers, really work with them, get them on board with what their responsibilities are. And then if we find the violations, we're in the unfortunate situation that we have to cite them. But public health, we want to come from a place of helping people come into compliance, not punitive and catching them in non-compliance. Now, while I say that, we do have retailers that have gotten to the 3rd violation, and it is pretty punitive when you're getting a $5,000 fine and a 30-day permit suspension. But a board can do more than the state law. They never can do less than.
Have we had any of our licensees get to the third level?
No.
Okay.
We've had nobody with a $5,000 fine.
Okay.
We've had a couple with a $1,000 fine, but they haven't come to the board because they chose to pay the fine since 2020. I can't remember the last time we were in front of your board for an appeal. But like I said, Littleton is one of my higher compliant communities, and we work really well. Almost every out of all the 10, I believe 9 of your retailers have stores in other communities that have these same regulations that Littleton has.
Okay.
They have in another town. They own a store in another town.
Sure. Let's go to the board members real quick to see if there's any discussion around those topics.
One question I didn't include was Pat Wason had asked about educational institutions.
Yeah, that's been in the regs since the 90s. No smoking in any education, no tobacco sales in any education, and that includes like college stores. Like Fitchburg State became a tobacco-free campus a long time ago, long before the workplace law. But they had a campus store that sold tobacco. So that means like if you have a convenience store, a little pizzeria or something on a school grounds, that there's no tobacco, no vending machines for cigarettes in the teacher's room in your schools, things like that. So it's very common. It's been in the regs, and it's not in the it's in the like Department of Education requirements, but it's not in the smoke-free workplace law about in terms of selling it. It's just that you can't smoke on school properties. So now we're just reinforcing it in the local reg. But you guys have had that in your reg since at least 2008.
Yeah, and that's section R on page 12 currently of what was sent out.
Yeah. Yeah, and I think on the cover sheet I put that you already had it in your current reg.
And apologies, I don't remember why I was interested in that one. In hindsight, as you bring that up, I was interested in the healthcare category.
I got wrong. Yeah.
Simply because it kind of gave some examples, but then perhaps didn't kind of fully cover it. I think it left it open to like what's a healthcare institution and what's allowed and what's not allowed. And I was curious if you had some suggestions on that, because I think it calls out specifically any retail establishment that has a healthcare institution within it, such as pharmacy, optician, optometrist, drugstore. But what is a healthcare institution? That's in the definitions
I think there's a definition for it.
Yeah.
I'm looking to see. I'm in definitions right now. Healthcare, yeah, there's a definition on page 5 of what a healthcare institution is. And there's an exemption in there because we have, for example, Fitchburg and Leominster has a BJ's on the line, and they sell, they have glasses, ophthalmologists, and then they sell cartons of cigarettes. So there is an exemption in there that would allow it in that circumstance. But if you look on page 5, there is a definition of healthcare institution: an individual, partnership, association, corporation, or trust or person and groups of persons who provide healthcare services and employs healthcare providers subject to licensing under the chapter. And then it says, or a retail establishment that sells pharmaceutical goods and services is subject to regulation by the Board of Registration of Pharmacy. Healthcare institutions include, but are not limited to, hospitals, clinics, health centers, pharmacies, drug stores, doctors' offices, and dental offices. And then there's an exemption if a town wants it for like a BJ's like situation.
So that's that green language.
Yes.
Yeah. Okay.
So it would be an exemption for an optometrician, optometric, hearing, or audiology, because those are kind of pop-up things that are sometimes in like a Walmart or
that's the point of it having the key language of
Yeah,
One
but
of those
there's an
services
exemption in
that
there.
is not subject to regulation by the Board of Registration. It's really that sentence that protects us from it just being any sort of optometrist that decides to sell tobacco.
Right.
Okay.
And it has to be in a retail establishment. So it just can't be somebody opening up renting out a space and now I'm going to sell cigarettes too. They have to be in a retail where the optometrist doesn't sell it. The retailer that they're in is the one that's selling it. If you
Okay.
have that exemption, but we don't, I mean, you could just go and leave that exemption out so they can't have it.
Okay. That's
The
fair.
exemption was really created because nobody visualized the BJ's situation that are all over Massachusetts, and almost every BJ's that exists in Massachusetts is on a line between two towns. There's not a BJ that's wholly in one complete town. So
Nice.
yeah, so I think that they put that exemption in there to you know, in response to kind of some of the pushback when this was a draft to that.
Okay.
And then just in terms
Because
of kind of
the state
evolution
law,
of-
the state law exempts the BJ's, but it's optional for the board. You don't have to just because the state law does. You'd be doing more than if you don't want to
Right.
give an exemption.
All right. As a board, we can do that.
Yes.
What were you going to say, Matt, real quick?
give me a sec.
Okay. Time's up. Sorry, just kidding.
What I was trying to remember is if there were any like kind of it calls out just I think for me it's the language that says anything that requires regulation. So where does that umbrella for healthcare institutions end, and do we need to call anything out more specifically? I understand it says like clinics, so that's where a chiropractor would fall, right? They're in a clinic. Do we want to call out more examples so that people understand? Maybe it's not necessary. Does a massage therapist, a licensed massage therapist, fall into the category? Are they included or are they not included? I think it's just kind of that. Is it?
I think so. So it says healthcare institutions include but are not limited to. So I think that part of the language is being inclusive in things. So like an esthetician is a separate license thing
Yes.
that provides some sort of healthcare. So
I'm not
that's-
asking if it's included or not. I understand that it would be covered under a not limited, but are not limited to.
If you would
I'm
like to
wondering,
specify,
do
we
you
can.
add some specific examples to the include list just so people are clear on it? And then again, I'm going back to it's the language that says provides healthcare services, employs healthcare providers subject to licensing under this chapter. That just seems so. I wouldn't want somebody to have an argument of like, well, what's a healthcare service or a healthcare provider subject to licensing? What licensing? So is a massage therapist included?
We can. If you would like to add estheticians and massage therapists, to be clear, we can, but it's not. Right now, most boards are using that under included but not limited to.
I'm not asking I'm not asking about the language being there. I'm saying, does it automatically fall into the bucket right now based upon the language that's written in here?
Yes.
Okay.
Yes, but if you would like further clarification, we can list more. And it is an important ask because I'll give an example of kratom powder. I don't know if you guys are familiar with that. Everybody and their brother is selling that now and it's popping up everywhere. CBD is not legal to sell in Massachusetts as a food or a drink, but everybody from hairdressers to bowling alleys to every corner store, gas station, mini mart has CBD gummies. And it says right in the state law that CBD cannot be in any edible form at all in the state of Massachusetts, and everybody and their brother is selling it. So I don't know. And it falls under the Agricultural Commission, under the hemp law, and they don't have an enforcement department. So they're just asking us to kind of, while you're in there, if you notice that they're selling it, can you kind of track a list for us? And eventually somebody's going to be doing something about it. So again, these types of places you're mentioning could suddenly be like, hey, I think I'd like to sell nicotine pouches, or I might want to sell vape. I'm not sure, but but it is included right now. So if an esthetician does open up, we could go under the not limited. You need your registration and a license. So you cannot sell tobacco in here. You could deny them the tobacco permit.
Okay. Thank you. As long as we're covered by
Yeah.
that list.
All righty.
Did anybody have any questions on this list, the blue list? Because that's the cover sheet.
Oh, the cover sheet. So the thing that I want to make sure we cover are the smoking bars or whatever. That was something that is new that we want to make sure is in the documents.
Yep. So lots of times people used to do environmental tobacco smoke regulation, a separate regulation from the youth access reg. And that was before the smoke-free workplace law prohibited smoking everywhere. So some people have old regs where they said no smoking bars way back then. So now, because there's really not a need to do a secondhand smoke regulation above the state law because of the smoke-free workplace law, unless you wanted to prohibit smoking in private clubs, you can put this right in your local regulation. So this would not apply to a private club because they're exempt. It would apply to somebody trying to open up a cigar bar, hookah bar, any type of smoking bar.
Okay. What's the board's opinion on that? Everyone wants to comment about their opinion.
It's a good thing to regulate when you don't have one. If you don't have one in the pipeline and you don't have one now, smoking bars are very hard to enforce, and they can be very troublesome because the law says a smoking bar, you have to buy the products there and leave your product there. So if nobody can open up a pack of Marlboros or smoke anything that they have in their purse. So if you buy a cigar, you buy a cigarette, you buy a vape pen, you have to finish it there or leave it there. And if you actually let them take it in their purse and take it home, it's a violation of your smoking license. And you have to get a special smoking bar license through the Department of Revenue. And you have to prove that the alcohol and anything else you might be serving in that bar is that you're making 51% of your profits off of your tobacco. So lots of times if you get somebody in there that's not doing the right thing, it takes almost 2 years to go through DOR to close them down if they turn out. And then usually your local bars with regular liquor licenses get very upset because these smoking bars tend to just allow everybody in, and they're serving alcohol and not selling. They compete with the bars because they're allowed to smoke and the bars aren't, and it's nearly impossible. And in the state of Massachusetts, there's only a couple smoking bars in Boston and a couple in Worcester, because it's just very hard. You really have to be that specialized cigar bar or that specialized hookah bar for it to be successful.
Okay. So, board.
I'm confused. I didn't think I had a question because I thought what you said is based upon the statewide ban of workplace smoking that you can't have a smoking bar anyways.
No, you can have a smoking bar is allowed, but because of most people don't have environmental tobacco smoke regs because the smoke-free workplace law bans smoking in so many places. Because like back prior to 2005, people had environmental tobacco smoke regulations where they restricted smoking in some work sites like restaurants and town halls and things like that. You don't need to have that separate reg now because the smoke-free law replaced that. But they do have an exemption that allows smoking bars.
So okay. In that case,
we highly recommend.
I would go ahead and say no smoking bars.
Yeah, we highly recommend you keep it in your draft. You could have a public hearing where people come and give their input, and you'll change your mind, or like there's no commitment to anything other than put this in the draft and we'll get it out to the public and see what people think.
Yeah.
Now we hand deliver this to all your retailers and we have them sign that they receive it, and we'll answer any questions on the draft that they have on a one-on-one visit in their store. but then you guys would post it wherever you post your public notices for any type of hearing that you have. And then we also recommend, we'll draft the hearing notice for you, and we would recommend that, like, say you're going to book your hearing at your April meeting or your May meeting, your whatever your next meeting is, you would have an open written comment period so people could submit written testimony prior to the meeting, and they'd have to get it to you the morning of that meeting. And
We'll actually try to get it like a week ahead, so that way we have time to read it, because morning of is
Yeah.
a little challenging.
well, at the hearing, you don't usually vote that day. You just say, thank you for coming. We're going to take everything you say under advisement. And then you absorb what everybody says. And then in your next month's meeting is when you vote on it. Unless you're one of these boards who has nobody show up at all, then you can close the hearing. If nobody submitted any input and nobody shows up at all, boards can close the hearing and vote on whatever they think is necessary because there's no additional input.
Right.
Yeah.
Okay. Now we're going to be an open board, and we'll make people that if they have something that they would like to say, they can say.
Right.
So, all right. Is there any other things in the document that we've got sent out to us? Is there anything else you guys like to discuss? And also, does somebody want to take point on this to get it through some of the edits and things like that, to work with Francis on getting through the edits?
I will edit it for you and give it to Francis, unless
Okay.
Francis wants to do it.
Okay.
Francis, would you like me to do this for you as your tobacco agent?
You got to twist my arm, I guess.
Okay. So,
I'll call you tomorrow.
yeah, I mean, there's not going to be too much, but what I'll go through the document now, and where it says city, town, I'll make sure that it says Littleton all through it. It's marked draft. You know, we'll leave everything in that was just discussed tonight. The only thing you didn't discuss is no permit renewal if there's outstanding fines. That's the usual practice of boards. We're just asking you to put it in your local reg. And then the other one was no permit renewal for 1 year if there's 3 sales to a minor in a 12-month calendar year.
What is the current, that's currently not in there at all?
No, you have, if there's 3 violations in a 36-month period, there's 3, 7, and 30-day suspensions. But one of the most egregious violations is to sell to a minor. And
Yep.
in the history that I've been working with Littleton, no one has ever sold 3 times in 36 months, let alone 3 times in a year. So I don't think we're looking at Littleton. It's something that people are putting in the draft. I don't have a recommendation either way. I would be very surprised in my lifetime of tobacco control if we would see a Littleton store sell 3 times in 1 year, because we do it. If they sell to a minor once, they get 2 re-inspections. And then if they sell a second time, they get 3 re-inspections. And then if we go in the database and they sell more than once, the federal program comes in and does extra inspections. The state program comes in and does extra inspections. And I have never had any, in all these years, we haven't had extra inspections in Littleton. So, I mean, it's one of these things that it's somebody could lose they can't renew their license for 12 months if they have 3 in a year. But if you have 3 sales to a minor in 1 year in Massachusetts under the state of emergency that's been in place for youth smoking and vaping, that's 3 sales in 1 year is a very egregious record. You'd be on everybody, the federal list, the state list, the DOR list. You'd be on the no list. So I think it's a hypothetical. I don't think we'd have that situation in Littleton. And then let's just say you had somebody have 3 in a year. They'd get $1,000 fine and a 3-day suspension. Then they'd get a $2,000 fine and a 7-day suspension. And then they would get a $5,000 fine and a 30-day suspension. They still would get all 3 of those, but now they'd get 1 year off, where the next permit renewal, they'd get a year off. So they're still going to get $8,000 in 38 days of suspension.
But then this law,
41 days of suspensions.
but this is when it comes to renewal, they have to wait a year. And so what happens then is that if somebody's on the wait list, they can get bumped.
Yes. I mean, I don't foresee it happening. So to put something that restrictive in there, it's a coin toss. You can always leave the language in your draft and make that decision at the final.
What's the board think?
I mean, I certainly think if they have outstanding fines, they can't renew their license. That seems like a no-brainer.
Mm-hmm.
Um,
What about the 1 year
that piece
restriction?
of a renewal with multiple concerning behaviors in the past. I think that comes down to it that because that basically results in a revocation of their license. Whether we revoke it today or we say you can't renew it in 3 months, it has the same effect at the end of the day. So I'm not sure which way to go with that. I mean, if we're going to say you get 3 and 12 months, you can't renew.
Yep.
I
You
admit
have the
part of me
authority
says,
to
in
do
that
that
case-
anyway.
no, that's what I mean. But part of me is like, going, if we're going to use it as almost a passive, you get 3 and 12 months, so that 3 months from now, when it's time to renew, we're not going to allow you to renew. We may as well at number 3 go have that discussion of do we do a passive revocation that you can't renew, or do we do an active revocation at number 3 going, we know in 3 months you're not going to be able to renew anyway because you've already met the non-renewable standard. I guess it's just that matter of, do we allow the regs to be a passive process to do it, but then let them still function potentially for months and months? I mean, depending on how quick their errors have been, they could be going 6 or 9 months, knowing that at the end of 9 months they could, they're not renewable, but they've already met that non-renewable standard. I don't know. I'm not sure what's better, letting the regs do it passively, or we simply make that as our standard. I don't know what's better. Part of me is like, if you've met that standard, then it's an automatic revocation. Or the board can choose not to take that route if someone has made meaningful differences in education and staffing and leadership and those kinds of pieces. But then by the passive part of the regs, they would still end up, even if they do, we've made horrible mistakes. We've done 1,000% of the things to make it right, but we still can't renew anyway. So I guess it just kind of, it leaves, I don't know. I'm talking you through. I'm thinking out loud. And I apologize.
There's an appeal process,
right?
So that could be handled through the appeal process.
Okay.
Yeah.
I was looking at the draft we had previously looked at. This language is in there for the draft we were considering, but it wasn't shaded any color. So I think we didn't look at it. So it means it was I think it means either we thought it was already in there, and so if you're saying it wasn't, then we skipped over it. But we hadn't discussed this particular point because I don't think it was shaded a certain color.
Okay.
But then
I'm not sure.
I don't think we had the fail to pay all fines version of it though. So I would say we could add that one in there.
Section E, paragraph 6 and 7, which are referenced in those bolded number 1 and 2 items, are actually not linked appropriately in the text. If you actually go to section E, the one that we're actually viewing, section E, paragraph 6 is titled "Tobacco Product Sales Permit Shall Not Be renewed." Is pay all that's there. That's true. And then paragraph 7, a tobacco sales permit will not be removed. Blah blah blah. Look at that. It's there.
Yeah,
okay.
It's supposed to. So I think 6 is supposed to be green, and it's not.
Yeah. So in my opinion, I actually mixed on the second one. The first one is a no-brainer as far as I'm concerned. The second one I'm a little mixed on. I'd like some additional comments on that. So we can have it in there as a highlighted section to say, maybe we will, maybe we won't. It seems to be punitive to me. But I get it. So from a health perspective, I also understand if somebody is really doing all these things wrong and they refuse to correct it. And I also see that as an appropriate response. So
we do space out the youth access inspections, so it wouldn't be like they'd have 3 sales in January, February, March, and now you're waiting to the following January to renew their permit. But we do space them out.
Kevin Baker, any comments?
No.
Okay. All right.
I think everything else has been discussed.
Okay. We do have two people in the audience that just want to see if they have any pointed information about that. If you do, you can raise your hand. Okay, seeing none. All righty. So why don't we go ahead and you go in and dress it up, work with Francis, get that rolling, and then if we have a draft, as far as the mechanics go, it's February, so we would have another maybe a public hearing the end of March. Is that appropriate? And then a final public hearing the end of April. Is that the mechanics, or do we need to do another one in there somewhere?
If I can get this draft ready and you give me the date of the March to do, you want to set your March meeting for your public hearing, we can get it, I can get everything out and ready. I can get it to Francis and he could, proof the draft, make sure it's as discussed tonight. And we could get I can send him a draft hearing notice and we could get that notice out and we can get it delivered, make the copies. We'll make color copies for each retailer and we'll deliver it to each store. We could do that next week.
Okay, do we want to put this before we have the public hearing?
No, I'm sorry. The next meeting, you guys will review the draft and then April do your public hearing. I'm sorry, you
Okay,
said hearing. So I was going to say you only need one hearing. Okay.
Okay.
So I'll come back the end of March and we'll plan on an end of April hearing.
Okay. So
I'm sorry, I
with that,
misunderstood.
no, that's fine. With that draft, Francis, if we could also run it by town council as well.
Sure.
Can I ask who your town council is?
Tom Harrington, Harrington Heap.
Okay. We love Tom Harrington at Harrington and Heap. So they're very, very familiar with tobacco issues, and they represented Northbridge and a couple of our other towns.
Okay. So, all right, so that'll be good. We'll get that reviewed. Anything else that I'm forgetting, board, or Francis? Anybody else have any other discussions on this point? If not, I say we move on to our next item. Okay. Thank you, Ms.
Thank you.
Hemley.
Thank you, Joan.
No problem.
All right. Bye-bye.
All right. Yay, us. Very happy about that. That makes me smile. Okay. It is now 8:10 and we are up to our ID decision support tool. Yay.
Okie dokie. The good news is it looks like I've found some better source for our COVID-19 numbers now that we're kind of at the tail end of that season, but I don't have them in here yet. So what we have is our vaccinations, 18%. Wastewater numbers remain pretty darn low. In the respiratory illness world, our flu status has dropped to low. The state also has a respiratory illness category, which is more broad of an umbrella, and that's a moderate risk right now. I might add that in here. I'm going to take a look at what their definitions are for that thing. And then RSV is the only kind of bummer one that one is actually starting to increase again for New England. So that's not a Massachusetts specific number because it's a region based on the CDC. So unfortunately, that one's gone up. I think last time it was just over 5%. Now we're at 11.2%. So there are still plenty of respiratory illnesses out there. So please, the usual, make sure that if you have some sort of illness, you're wearing a mask, covering your cough, senior physician or other healthcare provider, and trying to protect those that might be immunocompromised or otherwise more concerned if they were to catch one of these illnesses.
Okay. Lessons learned from vaccinations and things like that last year. I know we talked about it a little bit. Does anybody else have any other thoughts on lessons learned from this past year's vaccinations? Because I know everybody's sitting here going, we need to get those rates up, but
I mean, I think just from what I've observed is that people just don't think it's necessary. COVID's not serious anymore. It's not going to hurt me. A lot of people have had it. People say, "Oh, I tested positive for COVID," so I kind of get that sense, and so there's a feeling of like, I'm just not going to bother with a vaccination. I'm actually a little surprised that the difference between our influenza vaccine and COVID vaccine were that far apart. Because while 46% for influenza is still not, nothing to really cheer about, that's a lot bigger than COVID. So that one surprised me because I kind of feel like if you're gonna spend the time getting your influenza shot, you're actively saying no to a COVID shot because they're all offered.
I was going to say they were offered at the same time at our when we did them twice in time.
Pharmacy, doctor's office. I mean, I can't imagine a place that's saying, "Would you like your influenza vaccine?" Yeah, can I get COVID? Oh no, we don't do that here, right? So,
right, yeah.
Like I said, that difference in those rates is kind of shocking to me. So,
okay.
I'm wondering if we would like to entertain in the springtime or summertime some investigative work around this, and maybe it's a survey, maybe it's a question. Do you plan on getting one? If not, why not? If so, why? And see if we can come up with any reason. And then I think this board.
Maybe we could reach out to maybe we could reach out to a couple of residents that might be a virologist or a data scientist or something like that might be able to come up with a survey or they may have data already from another.
Yeah, if they have data, but it's that like, how do we kind of really connect to the people and try to figure out what are there barriers that we don't know about? Are there misconceptions we don't know about? Like I don't know where to start, but that number is so low. There has to be something. I feel like there has to be something relatively easy to throw a rocket off. So I think that this board, either with or for our health director, should set a target that we want to achieve for next season. If this is a measurement of success that we want to hold for the health of our community, then we should set a target. If this board doesn't feel like that, then I understand, but I would like to have that conversation again, springtime, when it's hopefully not a big issue, but I think it's the responsibility of this board to figure out what the level of importance is for our community for things like vaccinations. And if we think it's important, then I think that that a target should be set that's publicly available and that we should say, as a board and a department, we are working towards.
Okay. We'll put that on an agenda item and let's do it in April. Let's have that discussion. Okay. Anybody else have anything about the ID to support tool? There's nobody in the audience, so can't even have a public input on that one. Okay. All righty. Correspondence. So we've done the 7:25. Now we're at 7:30. There's nobody in the audience right now for public input. However, board member updates. Okay. Yay. So I think you've seen the information that Francis sent around that Dan got to me, which was that the charter committee has recommended that we go to an all-appointed board by the select board. And what I would like to do is to have I know my opinion on this, but I don't want to express that quite yet. I want to hear from the rest of the board how people feel about that. And then how, as a board, we may want to respond to that. I did put a strongly worded letter together that we can send out to the charter committee if we would like to do that. That was sent around to people. And then also, there were some comments made during the charter committee that a board of health is similar to a conservation Concom board. And I know Dan and well, I won't speak for Dan. I'll speak for myself first. That a Concom board and a Board of Health are not the same. It's not that they beside the fact that they focus on different areas of the law, there are different things that the boards can do and not do. And the Board of Health actually, as you saw tonight, has some pretty powerful tools at which we can strengthen and change and create regulations and law. So that is kind of there. So I'm going to go around and let people have some moments to speak before I speak some more. But I would encourage people to speak and see what's going on. So why don't we start with Dan, if you want to set the stage a little bit more. I know I didn't set it very well with that, but if you want to start to point a little bit more out, I think that might do us some well.
Before we get into the discussion, could you give all of us a little more understanding of where we are in the process? I understand that charter committee meeting was from February 10th, I believe.
Yeah, it was from February 10th. So we're still in the process of discussion. They're putting together a draft that they're going to go put before the select board. They're looking to put that draft select board sort of kind of thing by the end of March, sometime in April, I believe, Dan, if that's what the chair of the committee said was going to be happening. And then there's a process by which the board has to vote on it. And then it has to go to the legislature to be voted on. And then it has to come back and be voted in the town. And so there's process that happens, and it's going to be a couple of years yet.
And will the committee, will they talk to us? Are we expected to talk to them? Is that an opportunity or no?
So I let the chair know that I was kind of surprised that we had come and made a presentation to them. We showed them the importance of that, and then we heard that we might be a hybrid where we get appointed an MD sort of kind of person if there's not one on the board, but then we would still be elected, which I thought was kind of an interesting approach. But then at the meeting, it went completely, everybody's appointed. So that's kind of where it was. There was no discussion or saying, hey, we're going to go talk about that tonight. I received no email or notification. Matt, you being the vice chair, I don't think you received anything. Right. And none of us kind of saw it. So that's where that was kind of a surprise from that perspective. So yeah, that was kind of interesting. So that's kind of the stage was set. Dan brought it to my attention. I immediately reached out to the chair and asked for a meeting with Dan and myself. So Dan, if you want to say a few more words about it, that's kind of where it is right at the moment. Does that answer your question, sir? Okay. Dan, do you want to fill in some more blanks or expand upon things?
I can try. Obviously, we can't speak for the perspective of the charter committee.
Yeah.
They obviously, Kevin put a presentation. That was a number of months ago. It sounds like the charter committee talked to most of the departments and boards and committees in town to get a sense of what their jobs were and stuff. The meeting came up as they were trying to finalize their draft before it goes to the select board mid-March. And as part of that process on, I believe, the 10th, they were basically going through anything they hadn't decided on yet. And some of the ones that came up that night were the town clerk, Parks and Rec, and us, and planning, I believe, were all that night's kind of cleaning up what was still outstanding on their list. And during that process, they shared a little bit of kind of the mindset, the tool, the framework they've been using from one of the consultants. And kind of the framework really looked at a couple different big things. I don't have a copy of it, so it's only from what they shared in the discussions in general. And that some of the things they looked at to decide elected, appointed, or something else was whether elections were contested on a regular basis. Basically, were they able to get people to serve? The required skill set to serve on that committee. do you need to have some particular skill set? For Board of Health, what criteria do you need? They did not go into what that looked like for any of the boards. It was basically, is there a skill set, a knowledge base required, whether that's for planning or Parks and Rec or health or anybody else. Learning curve to get up to speed and be able to be successful and effective on a board, and how interconnected that board or committee needs to be with the greater community. It sounded like were there kind of some of their big check boxes of left versus right, elected, appointed, or something else. During that discussion, they had talked about Parks and Rec, and they had gone to an appointed perspective. They talked about the Board of Health discussion for the 10th of February was minutes. It was very, very short. The chair shared that they had spoken to a member of the select board earlier in the day, and that member had shared that the Board of Health was a lot like Concom, and that member of the board was actually in the meeting as an audience member and was addressed and presented to the board briefly that Concom provides oversight and enforcement of regulations around wetlands and those kind of things. Board of Health does the same thing for septic systems. So in that perspective, they're both pretty much the same and the same kind of job. After that discussion, the committee very, very briefly went through and went, oh, that makes sense, I guess. And at that point voted that it sounded like the placeholder had been a hybrid elected model, had been their placeholder undecided. And after that discussion, it was the Board of Health should be appointed. My perspective, just as a member and as a resident, most of you guys know I was on the Borica Board of Health for about 10 years before I moved to Littleton. It's an appointed board, appointed by the select board there, and I'll be honest, I had no issues functioning in that model. I've talked to Cheryl Spara, I believe it's Spara, who is the director of the Mass Association of Health Boards, basically a professional organization for health boards in Massachusetts. And her perspective, she's an attorney, and her perspective has been consistently that elected boards of health are most appropriate. It's about a 2/3, 1/3 split right now, about 2/3 elected, 1/3 appointed. Her rationale as a health board expert and as an attorney is that because of the scope of responsibility and, more importantly, the scope of authority that boards of health hold under Mass state law, that elected boards are more directly answerable to the electorate, and as a result of our ability to basically enact law independently that cannot be overridden at the local level, that having the board answerable to the electorate is important. The other perspective is that because of the scope of power and the unique responsibility of a Board of Health around public health, which is not always the public health policy, as some of us have learned, is a challenging task to accomplish in some circumstances. We'll pick the recent unpleasantness. That public health decisions are not always the most popular decisions. And as a result of that, appointed boards who serve at the will of another body are tend to be more subject to influence by small groups of those in power rather than the electorate or other things. Certainly not talking about our community or our individuals or our boards, but just as the example that if the Board of Health in East Overshoe, Massachusetts is appointed by the planning board of East Overshoe, Massachusetts, and they decide that we should not allow smoking bars in East Overshoe. The planning board has been working with 5 different smoking bars over the last 2 years to bring them into the community. The ability of the planning board to appoint or remove members of that board of health who may disagree with the 5 smoking bars in their community places the independence and the responsibility of the board of health outside the board of health and with some other body who can simply go, we're going to remove you and appoint folks who may be more likely to act in a way that we think you should act. It basically makes the board of health a subcommittee of whoever the appointing body is. I am not saying that is the case. I'm not saying that would ever happen in our community, but that from a mindset is the concern that sometimes happens, and why elected versus appointed boards are often a discussion. I personally, I think elected is appropriate. Again, I've served on both. Without speaking out of school, I have found serving as an elected member not a challenge from being elected, but being a member of the community and working with other boards. I felt more pressure to act in one way or the other here as an elected member from other boards than I ever did as an appointed member in a different community. But that's, again, just been my experience. So at this point, I don't know what other folks' thoughts are. I'll be honest that we have little to no say or input at this point. No matter what the charter committee makes for their recommendations, if they are just that, they are recommendations per our discussions with the charter committee, that it goes to the select board, who can take the entire thing as is, change pieces, or change the entire thing at will if that's their will, before it goes to, and again, I'm not sure if it has to go through town meeting and then the legislature and then come back for a townwide ballot. I believe it has to go through town meeting before it goes to the legislature and then comes back for a townwide ballot. I'm not sure. So we are a long way away from it being implemented, but as far as our ability beyond being members of our community and registered voters, we are basically at the will at this point of the select board and then the community at large as it works through the process.
Kevin Baker, have your hand raised.
Yeah, I was just curious, and Francis, you might know the answer to this. How did the folks on the charter committee become members of said charter committee? Were they elected, or how did they get that role?
I believe they're probably appointed by the select board.
Appointed by the select board to determine whether other boards or positions be appointed or elected. Okay. Thank you.
I know the select board appointed a lot. I'm not sure if other boards may have had appointees as well. I'm not sure if finance, somebody else may have had seats, kind of like they do for other ones, but
sorry. We didn't have an appointee. Go ahead, Matt.
I know we did.
I mean, kind of just playing off of what Kevin Baker just said. I know they repeated multiple times in the charter committee that they could feel comfortable that they were just making a recommendation and that the select board could, further restrict from what the recommendation was. And I think it was putting people's minds at ease. It'll be okay that the select board will then do what's right. It's incredibly concerning to me that the select board is preempting that and going directly to the charter committee, making recommendations for what the charter committee should then recommend. That there's a conflict of interest there. If you've said, hey, charter committee, I think you should put this in, or this is how you should treat this, because then when it comes to the select board, I have concerns about then the weight which they're going to be giving that information.
Yep,
Yeah, that's
I
clear.
agree. No, I agree. Mr. Baker, you still have your hand raised.
Yes, thank you, Mr. Chair. I was just curious. I can't see it. I'm on my phone right now. Is the Board of Health liaison to the Select Board present at our meeting this evening?
No.
Oh, because I was surprised to hear him speak at the February 10th Charter Committee meeting and misinform or leave out significant information in his comments about the roles and responsibilities of the Littleton Board of Health as a local arm of DEP in the Massachusetts Department of Public Health. So I didn't know if he wanted to have a meeting with us to learn a little bit more about what we do and what our roles and responsibilities are before he goes and talks to the Charter Committee about what he thinks we do.
He and I had a quick discussion over a chat session, message session, where I said that I disagreed with his position that he had presented, and that that he was factually incorrect in a couple of items, and that he politely disagreed with me. That he didn't believe that he presented anything inaccurate. But
Fake news?
What was that?
Fake news.
Right. But I'm not going to speak ill will of the person. But that was just our discussion that we had about that topic. So we definitely need to go back to the board. So Dan and I are going to go back on March 2nd, which is their next meeting that they have a public meeting. So unless somebody wants to, we can only take 2 people there because of the open meeting law. We would have to declare a meeting with them, if more people wanted to show up. So if you do want to show up, please let me know. We'll have to do that 48 hours in advance. But right now it's just Dan and I think that's okay unless somebody objects to that.
Well, if we wanted to join a meeting of more than 2 people, we have to ask, and they don't have to approve that request.
Right. So I think right now we're just going to have 2 show up. There's also an open public meeting to ask questions this Saturday. I think it's the 28th. And Kevin, I think you said you were going to be going to that.
It's at 10 a.m. I'm going to try to make it.
Okay. If you can't, I definitely would like one of us to show up to that. Matt, if you have some time to go there and find out some information, or that might be helpful. But we really need to be careful about that public meeting time, because if more than 2 people show up at that meeting while they're there discussing it, then we are in violation of an open meeting law. So we need to make sure that no more than 2 show up at that meeting. So.
But if it's a public meeting, we can show up as citizens.
Yes, but I don't want absolutely no problem there. But I want to make sure, because we have I don't want any sense of, there were 4 people from the Board of Health that showed up. I don't want any sense of that there. So I want to make sure that we're well within the law of that, if that's okay with everybody.
I think we should ask for a joint meeting with the Charter Committee.
Okay.
Under the understanding that they're making very impactful decisions, and as far as we can tell, they're maybe not fully informed about our board, and be able to have an opportunity to have a discussion, hear from multiple people on the board, and I guess put them in a position where they either say, yes, let's come have a joint meeting, or say, no, we refuse to do so.
I have no problem offering that out to the chair. I'll draft that email tonight and send that out to the chair. Do you guys want to do it? And now, here's the thing. They have the public meeting on the 2nd. Do you guys want to have that? I know, Dan, you've got some out-of-town trips and things like that planned, like the end of that week. So if we're going to do that, I would like to propose a date to see if their board can meet, give them a couple of evenings there to be able to do that. If everybody has their calendars available. I know we can't impose our.
We actually don't have time to make it a joint meeting for the second, do we?
We need
the notice we have to get?
48
notice?
48-hour notice, I'm pretty sure. Is that right, Francis?
Yeah, it's got to be
Yeah.
business days, though.
How many?
Right. It would have to, the
Business
announcement would
days.
have to be out by tomorrow afternoon,
Oh, okay. Right.
because that would give us Friday day, Monday day, and then meeting. So
Right. So I can see if the chair is willing to entertain that for the second for a part of their thing, to have it like, part of it to kind of come in and do a joint meeting for a little bit and then close that part, and then they can open up their own part of the meeting. So I can propose that. If not, what do people's calendars look like after that? I know they're trying to get their draft ready by the end of that week, middle of next week. So what do people's calendars look like for night? I know Dan's out that weekend. I would like to have Dan present in as many of these as possible. What's next week look like after that? The week of the 9th.
That's my spring break.
Okay. Are you going somewhere or?
Yes.
Okay.
If that's all we can do, I can potentially do it remotely. But I have I can't promise it right now.
Okay. We could
Mr.
just,
Chair, if
yeah, go ahead.
I'm gonna be the dark cloud here, and I'm just gonna say we can try to figure out a schedule. We could try to make a request, even if we meet with them. I guess I'm feeling a little bit, again, pessimistic and a little bit tilting at windmills. Do we actually think, one, it changes anything, and two, even if charter committee changes their opinion and their recommendation, does that actually change anything moving through the next step of the select board? Our select board is 5 members. 2 members of the select board are liaisons to the charter committee. 1 was present for this discussion, and we saw, or at least many of us saw, what his recommendation was, or his description at the time, and he did not certainly speak out against that decision or express any reservations about the charter committee's decision on the 10th. I guess I'm just wondering, is this a windmill that's not going to act, that makes no sense to fight? I will say, without going into a big depth in an open meeting, some things were shared, that some things have been said about the board, about effectiveness, our ability to operate as a part of a bigger town government community. Some things were rather pointed that the charter committee shared with, that they have been information they have been provided with from some ones unknown to us, that I think this might be a windmill that's untiltable, and our efforts to tilt at this windmill is only going to reinforce some opinions, accurate or not, agenda driven or not, that have already been shared with members of the committee, and that I will share that some part of me is concerned that this is, rather than being an effective advocacy for the Board of Health, this could easily turn into evidence of why there are challenges and issues that warrant a change in the model. I realize that's a dark cloud and pessimist, but that's my concern that I want to also just put out there.
But my understanding is it's not just whatever the charter committee says the select board is going to do anything anyway. Because it's my understanding that the select board cannot go further than the recommendations of the charter committee. So if the charter committee says a hybrid board is recommended, the select board can't then say, no, we're going to go with a fully appointed board.
Yes, they can.
They can do that?
Yes, it is a recommendation only. The select board makes the final call of what goes forward to.
I guess the language I heard in their meeting was, it seemed so repeated that it's like they're providing some limits to it with the recommendations, but you're saying that it's just.
Prior to that, the meeting on the 10th, They had been before the select board, and again, I'm paraphrasing, so please forgive me if I misspeak. But basically, it was from the select board to the charter committee of make your recommendations of what you think is right, leave the politics to us, and we will make the final hard decisions if we think we need to, if it's politics. You guys do what you think is right, and I think they are doing what they think is right. But they were told clearly, leave politics out of it, leave personalities out of it. We will handle that when it comes to us.
So
that to me means they are gonna, if the charter committee says they feel one way and that the select board feels a different way, that it's the select board will make the hard call, will take the action based on what they think the action needs to be.
So I will certainly ask to have a dual meeting. I have no problem with the windmilling. I think it's important enough that we at least try to get back on the 2nd of March in front of that board and say, you guys were misinformed and here's the real thing. Like, we have that data. There's nothing, we have the law book that, we can print out and say, here's the law book that this is what boards of health are responsible for. Oh, by the way. And, those kinds of things that we can give that kind of data to them that we gave them to them already. We can do it again and see if it sways their opinion at all. Right? I have no problem going and giving that information. The other thing that I do want to point out is that according to the Mass General Law that does organize boards of health, it does say that you can either be an elected or an appointed board. So it does say that in the MGL as far as, which direction to go. My opinion is that it should be elected. I agree with Dan on this. It gives the voters the direct ability to have a voice in what's going on without being filtered through another round of committees and things like that. The other thing that I would also like to point out is that someone also said that it allows a single voice to be presented. And in my opinion, democracy is best served by the largest voice possible. And that a power group of a few does not necessarily represent the voice of all. And so we need to make sure that that's also represented there. The other thing that was also mentioned was the organization of how the health department is managed within the town. And it has always been the organization of this, that this board sets the policies and all of that kind of good stuff. And there are some adjudications that have to come back from the health department to us, as example, Title V and things like that, or smoking, tobacco reviews. And there's a whole bunch of things that have to come back to the board for specific review, but that the people that work in the town and do the day-to-day operations are largely managed by an organization within the town. And Francis, correct me if I'm wrong, but I think that is, and board, correct me if I'm wrong, I'm like 99% sure that is the understanding that everybody has. So unless I'm wrong, somebody can come and slap me about the head and face, I'll accept that. But I'm pretty sure that was the organization that we set forth when we set up the health department here in town locally as we moved away from the SHOBA. So that's there as well. And then the other comment that I've heard a lot about was, well, why did we move away from the SHOBA? Yada, yada, yada. We've been through that a bunch of times. It went before town. It was a town vote. It went that way, and we've done that transition. So that ship has sailed. We're already through that point, and there's no really kind of going back to.
But a point that was not initiated by the Board of Health.
Correct.
I think that's a point that has been forgotten.
Yep. So let's put that back out into the ether of everybody that's there, and let's make sure that that's also understood. So I think so. Let me see if I can collapse what we've just decided. People want to show up on Saturday to go do their thing. Please do that. Please try to keep it no more than 2 people. I understand there's a concern that, as a public, but I want to make sure that we are not stepping on anything with that. So I would appreciate a little bit of viewpoint for that. Myself and Dan are going to show up to the March 2nd meeting. We're going to let the chair of the charter committee know that we will be showing up, and we hopefully have a little bit of time to discuss the decision that they made on the 10th and try to educate them a little bit more about what the Board of Health does. And then I want to also, someone also suggested that we try to have a dual meeting. And it looks like the earliest that we could do that dual meeting would be the week of the 16th sometime. The 16th of March. So is everybody okay with that if I suggest that time somewhere in the 16th of March to see if they're still willing to do that?
Sure.
Matt?
You're getting different opinions. I think we should ask for the second. Dan is, I believe, thinking maybe we shouldn't ask at all.
Dan, I think so. I've heard Dan's thing, and I am thinking that it is important that we push forward with this. So I'm going to push forward with that.
Okay.
I will not be a barrier
because we have the time. But otherwise, if they want to get things moving quickly,
I will reach out to Betsy and see if we can get a dual meeting for the second, if that's even possible. If they're willing to entertain that. If not, then the week of the 16th would be the next time that we could meet. Okay. All right. I will try for the second. I will text Betsy tonight then. See if we can do that so we can get the ball rolling tomorrow. All right. Does anybody have anything else on that subject? And then we can close that sucker out. Okay. Anything else you want to talk about? I'm not going to say we're closing that for now. I'm just saying, just that active discussion. Does anybody feel important about wanting to open something back up on that topic, or are we good for right now? I think we're all good for right now. Everybody's
good.
Everybody's good. Okay.
And
All
Dan,
right.
I just wanted to say, Dan, I appreciate your comments about these being futile efforts. And I don't know what's going to happen, but I think we have to do our best for the residents of Littleton to make sure that the Board of Health always has Littleton's public health in its best interest. And if the positions end up getting assigned by the select board, you can't say that. So I think we need to do our best.
No, I think I completely agree, and I'm not trying to minimize our role. I would hope you all understand how important I think the work that we do and the department does is for our community. I'm also just trying to be a bit of a realist. So, but yes, no, I obviously am committed and feel important about the work we do. So,
Okay. All right. So, any other board member updates? Anyone? Bueller? Dan, Matt, Kevin, anything else? Okay. Francis, do we have any other administrative things we'd like to bring up?
No, it's past my bedtime.
I understand it may be past your bedtime, but I just want to make sure, is there anything else that we want to bring up in our meeting tonight? I agree. It's getting a little long in the tooth. I understand we're almost to 9 o'clock. It's been almost 2 hours. But is there anything else we want to bring up?
No, it's the stuff that we went at the beginning of the meeting for.
Okay, perfect. And seeing no other people in the audience, so there's no other public input that needs to happen. I think that's it. We've covered our agenda. Francis, keep me honest. I think that's it. Okay.
Yeah.
Perfect. Entertain a motion.
Mr. Chair, I'd like to make a motion to adjourn.
Motion on the table to adjourn. Do I have a second?
Second.
Any discussion? Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Dan Kane.
Dan Kane votes yes.
Matt Wason.
Matt Wason, yes.
And the chair, Kevin Davis, votes yes. This concludes our February 25th Board of Health meeting.